Good morning, everybody. We're going to take a moment while we are admitting everyone from the
Whoops. Sorry, I accidentally muted you.
No problem. So good morning, everybody. We are in the process of admitting everyone from the waiting room. So we'll get started here in just a moment. So please welcome to our abbreviated moment of awkward silence. So I will continue monitoring the waiting room to make sure that we have folks that are in here. I do want to take a brief moment to welcome our guest speaker, Dr. Eric France. I see that he has joined us today, and we're very excited to be able to feature him on our program today. I'm State Senator Rachel Zenzinger, and I represent Senate District 19, which is Arvada and Westminster in Jefferson County. And I will turn it over to my other co-hosts this morning to introduce themselves as well.
Hi, everybody. My name is Brianna Titone. I'm State Representative in House District 27. That's mainly Arvada on the west side. And happy to be here with you today to talk about an important topic and to give you some important information that it's going to be very valuable to you in the next few weeks. So happy to have you all here. Good to see a nice turnout so far, and looking forward to answering your questions.
And hi, everyone. Lindsay Doherty, representative for House District 29, which I have not said out loud very many times since we just got sworn in this week. So I'm so happy to be here. I'm really excited for this topic. I think it'll be great. And I'm just glad to see you all this morning. Thank you.
So we wanted to take a brief moment just to recognize some of the other elected officials that are on the call today. If you wouldn't mind just unmuting yourself and saying hello to all of us, introducing yourself and where you, what position you represent. I'm pretty sure I saw Commissioner, newly appointed Commissioner sworn in, Tracy Kraft-Tharp, if you want to kick us off.
Sure. Good morning, Tracy Kraft-Tharp, County Commissioner, Jefferson County.
I believe I saw one of our Westminster City Councilors. If you wanted to introduce yourself, Catherine.
Hi, I'm Catherine Scully. I'm a City Councilor for the City of Westminster. And good morning, everybody.
Do we have any other elected officials that have joined us today? All right, well, seeing none, welcome everybody. Again, this is State Senator Rachel Zenzinger, and we're very pleased to be able to host this town hall, our very first one for 2021. Our topic today, we hope, will be very interesting. There's been a lot of talk about the vaccination program in Colorado, and so we are hoping to give you somewhat of a state perspective rather than a local perspective on that process. But before we jump into our topic, we're going to go ahead and give some quick updates as legislators on what we have been working on. I figured even though this year's swearing in ceremony was much different than normal, that we would start today with Representative Doherty to kind of give her perspective of what it was like to be sworn in. So why don't we start with Representative Lindsay Doherty.
Thank you. Yes. So, you know, everyone, you know, I feel like all of the other legislators were telling me, you know, I'm so sorry this is your first day. This isn't a normal first day, but I had a great first day. I was just so happy and honored to be there on the floor, and I couldn't believe I was voting already. And I felt so it was just so great to be there. The opening was very short, a lot shorter than it is in prior years. I've heard that we might do some more of the ceremonial things on February 16th when we all come back. So it'll be great to see all of that. I did get a few guests, so my parents got to come, which was great. So they were able to see that all happen. And then we went straight into, doing some work, which was fantastic. I actually had 2 committee meetings the first day as well. I'm on finance, appropriations, and judiciary. And so I was able to get that full experience as well. So we were there pretty late, I think until 9:30 or 10. But I was just overwhelmed, I think, the first day, and so happy to be there. And I was excited. I would have stayed all night. So ask me in a few months if that's my same opinion, but I had a fantastic day. So thank you.
And I did hear that the Senate or the House went longer than the Senate into the evening. So I think you probably were more likely to experience an all-night session than I was. Next, we'll go to Representative Brianna Titone, where this is not her first swearing in, but perhaps can give us an update on our brief 3-day session that we've had so far.
Yeah, well, thank you for the introduction. Yeah, we had, an interesting first few days. I did have a completely normal session my first year, and then the second year started to get a little weird. But this year, we're adapting to the situation at hand, and we're making do with what we have. I worked remotely some of the time. I was in the Capitol on opening day and on Thursday, and then I was working remotely Thursday and then actually on Friday as well. So we have these options now. So as long as things don't keep getting worse, we'll keep using the tools that we have at hand, and then we will get back to a more normal way of doing things. And it's really enjoyable being down at the Capitol and seeing everybody. So I'm looking forward to the joint sessions when the senators come over, and Senator Zenzinger will sit next to us, and we have our little Senate guests. So it'll be a good time when we are able to do that again.
Well, thank you. And I look forward to it too. So as far as my update goes, I was just going to briefly touch on the legislation that we took up in this little 3-day mini session. So the legislature, due to the pandemic, only met as we are required to by the Constitution in order to certify the election, swear in the new members, and then take up just some small amount of business that was very timely that we were somewhat required to take up. And then a couple of key pieces of legislation that would allow us to participate remotely, not just while we are presenting legislation on the floor, but actually to participate remotely in our committees, which was not allowed by our 2020 rules that we operated under. And so one of the bills that we carried this in this little brief interim was to be able to permit legislators to participate remotely for committees as well. So to begin with, we passed House Bill 1001, which was that remote participation, or excuse me, no, 1001 was a bill that permits remote participation in party committee meetings. So many of you could perhaps be a member of a political party. And if you are, you're probably familiar that with this time of year is when the parties meet to do their reorganization, elect new party officers, elect committee members or district leaders or precinct captains and all of those types of positions. In order for those political parties to be able to conduct their business during a pandemic, we needed to run a bill because currently in statute, political parties were not permitted to be able to do that sort of remote participation. Last year, we passed a bill that was similar, but it was only temporary. It was for 1 year. So we have gone through and we've extended that for 1 more year so that political parties can meet this spring and do their reorgs. House Bill 1002 was for reductions in certain taxpayers' income. This was a bill that was sponsored by Senators Moreno and Hansen that made some alterations to the Tax Fairness Act that they passed last spring. And all it did is it helped clarify some of the tax refunds and tax refund changes that were initiated by the CARES Act, which will allow taxpayers to have some continued relief as we recover from the pandemic. House Bill 1003 was a bill that allowed for legislative proceedings during disaster emergency. This is the one that would allow us to participate virtually while we are in a pandemic. It can only happen during a declared disaster emergency, which is where we are right now, caused by a public health emergency. It's not something that would carry forward in any other circumstance. House Bill 1004 was a change that would permit the Colorado Uniform Electronic Wills Act to move forward so that people that are trying to get a will, an electronic will, would be able to do that under Colorado law. Senate Bill 1 made some modifications to the relief, the COVID-19 relief programs for small business. This was a bill that we passed during the special session that would allow or permit some relief payments to businesses. After that legislation was passed, there was a lawsuit that prevented that bill from moving forward with regard to the language that called out minority businesses and small businesses. Because of that, the aid was not able to actually make it to the small businesses while that was tied up in court. So the sponsors felt that it was really important that aid get to the small businesses as quickly as possible. So they made a modification to that bill and they removed any sort of references to small and minority businesses in the legislation so that it would not be privy to the lawsuit anymore, so that they could go ahead and get the relief out to the businesses. Senate Bill 2 extended the limitations on debt collections. This was a bill that was passed back during the spring, but it was temporary. It was just until December 31st of 2020. And so this bill extended that those limitations on debt collections for I think another 6 months pending the COVID emergency. So if we come out of a declared emergency, then that would end. And then finally, the last bill that we passed was Senate Bill 3, which was a fix to the Occupational Therapy Practice Act. This was an act that we passed in the spring regarding the renewing of the Occupational Therapy Practice Act. Unfortunately, there was a petition clause on that bill instead of a safety clause. A petition clause means that you have to wait for 90 days to see if there is a petition that would like to place on the ballot an initiative to overturn that legislation. And because of that, and because of when it passed, and it did not have a safety clause, which means it would have gone into effect immediately, we actually became out of compliance. The act expired before it went into law. So they had to go back and make a quick fix to that to make sure that the Occupational Therapy Practice Act did not expire because of the timing of the pandemic. And I believe that was all the legislation that we carried. I'm going to turn it over to my two co-hosts to see if they had any commentary about those bills that we passed during the legislative session.
Oh, yeah, you can say, I think you've said it pretty well. Not just things we had to get done immediately before we took our little break again.
And yep, just thank you, Senator Zenzinger, for all the comments. And I'll just say again, I went through the full process this week, so I'm ready to go now. We start in February, so I don't have anything additionally to add, but thank you.
Great. Well, then with that, what I think we'll do now is we'll proceed to our program this morning. We have had lots of new information about how the vaccine rollout is occurring here in Colorado, from local officials, from state officials, and it seems to be changing pretty much on a daily basis about how that vaccination plan is rolling out. We actually just found out yesterday that the vaccine amounts that we thought were going to be delivered to Colorado that were being held back in reserve so that everyone who received their first shot could ensure that they received their second shot, which is part of this particular vaccine, may not be as much of a supply as we were told. So that was a little bit of a shock that we learned yesterday. But our guest here today is going to be able to shed some light on all of this. His name is Dr. Eric France, and he's the Chief Medical Officer of the Colorado Department of Public Health and Environment. He is actively working on the COVID-19 response, really helping to create the community standards of care, working very closely with the governor's office in the pandemic response, and very specifically on vaccine education and the allocation of the vaccine. Prior to joining CDPHE, Dr. France served as the I'm going to admit somebody from the waiting room very quickly here. Prior to joining CDPHE, Dr. France served as the West Region Medical Director for Merck Vaccines in 2019, traveling to the West Coast to help care delivery organizations in their efforts to improve vaccination delivery. He was also a physician researcher on things such as vaccines, cancer screening, tobacco cessation, so a lot of different topics, as well as the Chief of Preventative Medicine, the Director of Population Health, and the Executive Director for Sales and Marketing during his 25 years with the Colorado Permanente Medical Group, which are the physicians of Kaiser Permanente. So with that, I'm very pleased to be able to welcome today Dr. Eric France, and he's already unmuted yourself. You're very quick. And while you are giving us a quick introduction, if there's something that I missed in your bio, I'm going to work on sharing my screen with you.
Perfect. Thank you. Good morning, everybody. Senator Zanziger, Representative Citone and Doherty, thank you for inviting me. And thanks everybody for being here this morning. A nice introduction. You've heard my story now. I suppose the other piece of this story is that, like Representative Doherty, I'm relatively new in state government. I've been in this role now for just about a year. So I began on February 3rd when we were just getting ready to start with this pandemic. And so it's been quite an education for me, at least on the government side, and how things work. I do want to speak today about where things are for our state around the vaccination efforts. I think it's always important, though, to remind everybody and start with maybe some high-level updates on where we are with the pandemic in our state and what seems to be important and working to help us control it. So you're probably all aware that over the last 2 months, since about mid-November, our cases have been slowly decreasing across the state. In mid-November in Jefferson County, probably the case rate was about 90 new cases each day for every 100,000 population. And now it's down to about a third of that. It's about 30 per 100,000. We've also seen that over that 2-month time, hospitalizations have fallen from a peak of about 1,800 people in the hospital to only 800 today, which of course is a big number still. And of course, we look at the positivity rate from tests. What percent of all tests done on a given day are positive? And the historic goal is to have that less than 5%, which means we're testing a lot of people and we're not finding that much disease in the community. And after being in the 12-13% ranges in November, we're down to about 5% today. So everything has been pointing in the right direction. And that, of course, is why the governor started opening things up a bit more, moving counties who were red on the dial to the orange. I think it's been 2 weeks now, allowing more people in restaurants. And I would say that so much of the work during the pandemic in public health is about taking bets. You know, it's like, well, I'm seeing these numbers go up. If I don't do anything, I think things are going to get really bad. I think we got to do some things, and I'm going to take the bet that by doing X, Y, and Z, these numbers will come down. And the lack of experience for pandemics, the fact that we haven't had one in 100 years, means there isn't this large evidence science base by which we can really know which lever to pull during a time of crisis. And so I am happy that it feels like we've done a good job over the year. And when I say we, I mean all Coloradans, because you are keeping these rates down, because you've been keeping your distance, wearing your mask, washing your hands, staying home, staying within your households. And the end result is that we have not been an overwhelmed California or overwhelmed in New York City. We've been doing the right things as Coloradans to keep things under control. So I commend all of you for the work you do and the effort you make to do and be safe. So I want to call this out too, because in the next 3-4 months, the way that we control the pandemic will not be through vaccination, I'm afraid. It's really these basic interventions that we've been doing over the last year. So my first message is we cannot stop or loosen the kinds of activities each individual is taking of being safe. We've done a lot of work with University of Colorado School of Public Health to model what the future might look like. And most recently, they've shown us that even as we increase vaccination rates, in the early part of this work, it doesn't really impact the number of cases, the number of hospitalizations, or the control of the pandemic. So while we're all excited that vaccines here, recognize that it's also not the solution for the next 3 months or so. Well, let's talk about the next 3 months. What do we expect to be happening with vaccines? And it's true, as Senator Zenzinger said, this has been a lot of change over the last couple of weeks. On the other hand, it's actually rather mundane and stable in the sense that we kind of know what we need to do. We started getting these vaccines in mid-December, and we knew we had to work through our healthcare workers who are taking care of people in the hospital, and our long-term care facility residents in skilled nursing and assisted living. And we knew they were the big groups to begin with. And so that's what we did. And we get a certain amount of vaccine from the federal government, from the Operation Warp Speed, OWS, every week. And the amount we get is proportional to the population of Colorado. So we're about 1.7% of the US population in the state. So we get 1.7% of whatever supply of vaccine exists. And for us, that translates into about 70,000 doses a week are coming to Colorado. So that's what we have. And the goal then is to be sure we take it and get it into arms as soon as possible. And in some ways, you might think that the best measure of success for the state is, do we almost run out of our total supply by the end of the week, by the day before the next shipment comes? And that would really be the goal. You don't want it sitting on shelves. You want it in people's arms. And if we're getting 70,000 doses, let's be sure that we're getting all those doses in arms every week. And so that's what we've built. And we started with this first level of working with healthcare workers, and we did that by partnering with hospital systems to vaccinate healthcare workers. And then we said to these partners, hey, can you also do all the doctors for our neighborhoods, the pediatricians and internists and cardiologists that are in their outpatient practices, and their nurses and staff? And so we moved into all those healthcare workers as well. And so that's what we've been focusing on. When these doses come to the state, you may not be aware, but there's actually 2 vaccination programs going on. There's the doses that come to the state and that we manage. And then there's a second arm, which are doses that go from the federal government to 2 large pharmacy systems, Walgreens and CVS. And Walgreens and CVS are contracted with the federal government to go vaccinate every resident of a long-term care facility. And we talk to each other, but in some ways they really are separate. And so, and the way it works is that if our state is to get 70,000 doses a week, we actually skim off a certain number of them, 15 to 20,000, that go directly over to these pharmacies to do their residential care program. And the state really doesn't have much control of those residential care programs because they're talking directly to the federal government and getting their shipments off of our allocation every week. And so we had a number of weeks where instead of 70,000 under our control, my control, it might have only been 50 because 20,000 was going to these pharmacies to get all those high-risk residential care folks. We talk to them a lot, ask them how they're doing. They're in charge of scheduling their visits to the skilled nursing and the assisted living. And we have about 210 skilled nursing facilities across the state. And their goal is to get all of those first doses into those 210, I think either by the end of this week or early next week. And then they're now moving into the assisted living facilities, and they'll get those doses done, I think, by the end of February. So they're working hard at getting that highest, most vulnerable population vaccinated. They're
Dr.
taking
France,
overall.
I'm
Yes.
sorry to interrupt, but I do have a question about that.
Yeah.
If you are aware of perhaps you have a parent in one of these facilities and it appears that they have not received their vaccine at this point, what would you recommend? Because if they're communicating directly with the federal government, should we be contacting state officials about their vaccine not getting to them, or who should we be contacting if we're aware of any of these residents in long-term care facilities that have
Sure.
not received their first dose of the vaccine yet?
Yeah, good question. So my mother-in-law is 90 and lives in an assisted living here in Denver. And Alita got her shot on Wednesday, and I think it was through CVS. And so most families will have been receiving communications from the assisted living or skilled nursing about when is it scheduled. And these pharmacies actually schedule 3 clinics for any assisted living. There's for the first dose and a second dose, and they have a third one in case somebody misses the first or second appointment. And so they start by creating a schedule, and any family member should be able to speak to the directors of the facility and say, well, when are you scheduled? What are your dates? And they should be able to tell you what the dates are. And if they say we haven't scheduled, I would certainly push back and say, well, why not? You know, we expect all of these families to be and residents to be vaccinated. There are a few places where the pharmacies were running a little behind, and the state has said to the pharmacies, hey, would you like for us to use our resources to come in and vaccinate some of these facilities to help you out if you're running behind? And so far they're saying we're good, but they know that we'll take up to 30 different assisted living residences and send some nurses and folks to vaccinate them from the state to help them out. So we're on top of it at the state level to stay connected with the pharmacies to get clarity on when they're doing, where they're having trouble. If you're hearing, of course, that there's any trouble with, you've called, they're not answering, they haven't told you, I would reach out to the local public health agency and you can ask them. You could also call our CoHelp, C-O-H-E-L-P. It's the Colorado Help line that answers questions around vaccines for the state, and let them know that you're having trouble, and that will get to us as well. You could also tell your state senator or representative's office, and I'm sure they let us know as well. So probably a variety of things you might need to try to kind of do that. So as I said, we've been kind of working through our supply. We were actually hoping that we would get 130 to 140,000 doses a week. We had the sense that at the federal government, they would send us 70,000 and they would take another 70,000 and put them on the shelf, saying that they would send that second dose, the matched second dose, to us in 3 weeks' time. Well, that's what we thought was happening, but we just learned yesterday and the day before that actually there aren't any doses on the shelf. And so at most, the federal government had about 500,000 doses in reserve. They didn't have millions of doses in reserve as we had thought for the nation. It was just 500,000. So they're going to throw those our way. And so instead of 70,000, we might go up to 90,000 for a couple of weeks. But we're really not seeing this big new outpouring of a vaccine our way. While you hear on all the news that there's kind of a failure with some of this vaccination programs, it kind of bothers me because it doesn't feel like it's a failure in Colorado. We're getting doses in arms as soon as they arrive, and we can only do as many as doses come to us. And so that's our big limit. And our vaccination program is being performed by a series of partners in the community. When we were thinking about vaccination, we looked early on to see how many flu doses we would typically give in a busy week in the state of Colorado during the fall. And we all see the campaigns, we go to our doctors, our pharmacies, and we get our flu shots. And there were times in September and October where we were giving 200 to 240,000 doses of flu shots using our existing infrastructure in the state of Colorado. So that told me right away, without building anything new, we can do 200,000 to 240,000 shots a week in Colorado, just using what we've already got in place. And we're of course getting 70 to 90,000 doses. So we certainly seem to have room to expand, and we plan on just doing that. One way of expanding in the future will be bringing in more pharmacies. So while the pharmacies are really focused on long-term care residences, there are hundreds of pharmacies in our rural and urban settings that have people and are ready to do vaccinations. And these are trusted partners in your neighborhoods. And so we know we have at least 300 the pharmacies that today want to start. We don't really have a supply for them just yet. And it actually, interestingly enough, will be another one of these federal programs. So when we have pharmacies like King Soopers and Walmart and others vaccinate, they will be skimming off the top from our weekly supply. It'll come from the feds, go directly to the pharmacies, and go into those pharmacy clinics. My hope is that they will be ready for us by the end of January or early February to start administering vaccines.
So I have another quick question. So how prolific are these pharmacies in other parts of Colorado? For example, the Western Slope or the Eastern Plains. How likely is it for them to have access to one of these big national chain pharmacies in order to do this?
So the federal government's created this relationship with 19 different pharmacy chains. And they asked us to choose 2, which we have, like larger ones to begin with. And again, the big ones are CVS, Walgreens, Walmart, King Soopers, Safeway. And so those are the big ones. And we have maps that show where all their stores are. And you see them in the Eastern Plains, you see them in the Northwest, Southwest, through the mountains. I mean, right there, pharmacies are in all of our communities. And so we see that as a really wonderful opportunity to expand access across these pharmacies. So they are very accessible. And so once we get doses and we start using them as sites, it will greatly expand where those vaccines are going to be available. The other group that is a little further down the road are people who are between 16 and 64 with chronic medical conditions like diabetes, heart disease. My hope had always been that you would be able to go to your doctor's office and get the vaccine at your doctor's office. And they know you have diabetes and therefore qualify for that vaccine. And so we will be working to expand where it makes sense into your local doctor's offices as well. I feel like I'm getting ahead of myself though, so give me a moment to step back. Who are we prioritizing on right now? It's these healthcare workers, and as you know, it's people 70 and older. And the healthcare workers that we're focusing on now are the broader ones, as I described. They're your dentists, they're your pediatricians, they're people in outpatient clinics rather than the hospital-based people. And I think there's about 125,000 of this more expanded group of healthcare workers. And then we're focusing on the 70 and older, pardon my dogs. The 70 and older represent, as you know, the people most at risk for being hospitalized or dying from this disease. And so we want to be sure that they're protected. And we have 562,000 people in the state who are 70 and older. And if you just do the math, 70,000 doses a week, 562,000, add the healthcare workers I described, and you're almost at 700,000 people in this category. And that's almost 10 weeks of work going forward. So 10 weeks takes me through January, February, and maybe even into the middle of March if we don't get more doses. And so you can see in some ways, I know what my work is right now, and I don't have to think much more about, well, who's next, because I just have such a big group of people I want to get vaccinated today. Now, of course, we are thinking about who's next, and we're working hard to see how do we get more vaccines so we can speed this up. And part of that will come with the use of new vaccines that will become approved through the FDA, the Food and Drug Administration. And I think the first one we're expecting would be the Johnson & Johnson vaccine, where we expect them to turn in their study results to the FDA in February. And my hope is that it becomes available through the emergency use agreement by the end of February. And by March, we'll be getting millions of doses across the United States from a third supplier. And then remember, there's AstraZeneca, which is a fourth supplier, and the US has signed a contract for, I think, 300 million doses from them. But again, it might not be till February or March before they get approved as well. So short term, we expect our current suppliers, which are Moderna and Pfizer, to only be able to give us 80, 90, 100,000 a week for the coming weeks, maybe through February at that level. And then I think they're saying that by March, those two companies, their production will have ramped up, that they'll be increasing their national production by 1 million doses a week. So that might increase us by, again, 1.7%, 17,000 doses a week. So much of this is about what can come to us as a state that we can then use and distribute. I would say, of course, it's been a frustrating time if you're 78 and you know you want to be vaccinated. Where do I go? Who can vaccinate me? Where do I get information? And it's true that it's been less than ideal. We have many partners in the community. Their health systems, so Banner Health, SCL Hospital System, Kaiser Permanente, UC Health, they all provide care, and you may be cared for within their network. You're a Kaiser Permanente member, or you go to UC Health, or maybe you don't. So you still can call these groups. I know I got a quick text from Kaiser Permanente this week that says we're vaccinating all Coloradans. Just kind of come through and put your name on the waiting list, whether you're a member or not. UC Health, Banner, SCL, they've all done the same. They're building these waiting lists, and you need to actually get on their waiting lists. Recognize for those of you who are 70 and above, our goal is to get 70% of that population vaccinated by the end of February. So we've got about 7 weeks that we're going to be vaccinating people. And if everybody shows up on Monday, 562,000, there are going to be lines. People are going to have to wait. And really, I would encourage you to take a step back and say, okay, I'm going to keep doing what I'm doing, staying safe at home, wearing my mask, and I'll get on one of these lists, and hopefully within 3-4 weeks, my turn will come up. So please be patient, because we can't do everyone right away. We don't have all the doses right now. And so we'll be working through these lists of getting people vaccinated. So you can find information on where these sites are by going to their websites. We have a website, the state of Colorado. It's called Vaccine for Coloradans. And there you'll see the lists of people who are vaccinating. Each county is a little different and how they do it and who their big partners are. You know, Jefferson County has the good fortune of having a very strong local public health agency. Dr. Mark Johnson has been the director there for 30 years. And while he's trying to retire, he's still on contract working with Jefferson County. And they're doing great work at partnering with the local hospital systems to get vaccines in arms. So Jefferson County Health Department is certainly a good place for information. And I appreciate patience when it comes to all of this. So I think that's the high level. Remember, we all need to stay safe and continue what we're doing, because that's really what's going to keep this pandemic under control. Vaccine is coming, maybe a little slower than we'd like. We have capacity for doing shots in arms in our state. If anything, we're not spreading it out even thinner because we just don't have enough doses to do that. And we're keeping our fingers crossed that, you know, production doesn't bump into any problems, that the supply keeps coming, and that supply will increase in the coming months. But you can see that if you're a person who has diabetes and you're between the ages of 16 and 69, I'm not having a shot for you until at least March. And you can imagine I get heartbreaking stories about people with immune compromised diseases who are 23, who are looking for a shot today. And I can't really move you up in the line, because we know people 70 and older represent a large percent of our total deaths and are 70, 80 times more likely to be hospitalized and so on. So we've made some decisions about who to prioritize first, and we're sticking with those priorities. So keep doing what you need to do to stay safe, and you know what those things are, and recognize it might be spring, early summer for some of us to be vaccinated. And I'll stop there and take questions, Senator.
Well, thank you so much. That was a lot of information, but we do have a number of questions that have been coming into the chat. I think that you mentioned that dentists have already been included in the medical professional vaccine distribution 1A. There was a comment about all of this individual's calls to the helpline don't seem to get answered, that it's an electronic menu only. Do you have any thoughts or feedback about that?
Yeah, apologies that we don't have a robust hotline in place in the state today, and we are building it out, and we're contracting with an organization that will have, I believe, to begin 50 different people answering the phone lines. And, you know, our goal, we recognize that that's a big piece of what causes angst right now, is that people don't have a place to call and get a quick answer. And you have to call you know, any one of these health systems, and then you're on their telephone wait to get an answer. So I think within the next week, we'll have a contract out, and then we have to give them the content to how to answer the questions. And my hope is that within 2 weeks, you'll be hearing about this one telephone number, you know, a branded Colorado Vax line or whatever it might be, and you call with any question, and our goal is to answer that phone within one ring. So it's coming. In the meantime, I think it's going to be a bit clunky as you try and find answers, and I don't have much of a solution other than ask your patience and forgiveness over the next couple weeks. Keep trying.
So when you were discussing the role of the pharmacies, a question came up from Bruce Morrison about, do these pharmacies actually have the super cold storage that is needed for one of these vaccines? I believe it's the Pfizer vaccine.
They do actually, which is why they are such a good partner, because the Pfizer vaccine, you're right, has to be stored in these ultra cold freezers, and the pharmacies have those. Or if they didn't, they ordered them and they have them before the vaccine even arrived to our state. So we've got 8 or 9 different hubs for these different ultra colds, and the pharmacies have hubs as well. And the nice thing too from the ultra cold place is that if I'm going to a skilled nursing facility, I'm taking maybe 200 doses with me, and you just take them all right out of that freezer and go. And it's very manageable from a supply side management system.
So we did have a couple of questions that were submitted to us in advance, and I was going to go ahead and put it into the chat here in a moment, but I'll go ahead and read it out loud. So how will the information to sign up for a vaccine or where to go for a vaccine be disseminated to Jeffco residents who are quote unquote off the grid? So, you know, we personally know people who do not have a cell phone or a computer, or maybe are of a particular age where they're not particularly internet savvy. We also have a number of homeless people that might fall into this category. And so we're just interested in knowing a little bit more about how do we reach that population with the method that the information about signups is being disseminated right now seems to be all online. And what would your response be to that?
Yeah, that's a great question. Thank you. You're right. And it may even vary by age group. So there are certain older groups that may be less confident in using the internet, and the younger age group that won't look at anything but the internet. And so we recognize that communication varies on a variety of factors. And so it's an issue, especially when you think too about the modern healthcare system. So if you want to be seen through a hospital care system, most of these hospitals, if not all of them, now use electronic medical records, and they have a scheduling module within that electronic medical record about how if you want to be seen, you have to actually be in one of these slots pretty much. And so they're in the space about, well, you know, I have to get you in a slot in order to be able to give you a vaccine. I can't just have you come in. So their whole tracking systems are kind of limited by some of these software aspects of modern care. So there's definitely work underway. We partner strongly with local public health agencies and community organizations that are already connected to different communities. These may be communities of color, low-income communities. There are strong partnerships with our federally qualified health clinics. Those clinics serve folks who may not otherwise be plugged into the internet systems sometimes, and they know how to reach their patients. And so doing a lot of work, we actually have a set amount of vaccine, 10% of this total shipment that we say, okay, let's just hold this and use it to get into the difficult neighborhoods that wouldn't otherwise maybe naturally be able to get online and do this work. We'll work with community organizations, and we'll pull from our set aside to vaccinate these folks as we build clinics. I think, you know, in Jefferson County too, the healthcare, again, the public health agency knows its partners, knows its population, and knows how to connect with folks, and will be working closely with the state and other community organizations to get doses to everybody in the county. So I do feel good that we have those processes in place to connect with folks and make sure that we're communicating with them about the value and the availability of the vaccine.
And then we also had another question back up in the chat. What's the prioritization of Coloradans with Down syndrome? I've heard that they're the highest risk, higher than elderly and immunodeficient.
You know, that's right. The challenge with these lists, like who are high risk, who's an essential healthcare worker, is that these aren't necessarily written in stone. And so we're always learning. And I think one area that we've learned, of course, is that people with Down syndrome are at increased risk for severe complications with COVID. And so they too are now in one of the higher risk categories. Now these high risk categories, again, are more in the phase 2 timing for vaccine. We're still focusing on the people who are 70 and older and will until the end of February. And so the thing that might change is like if something happens and all of a sudden we're getting 200,000 doses a week, well, then we're going to be expanding and getting things done more quickly. But for the most part, high risk groups are March and afterwards, including persons with Down syndrome.
I think Brianna is taking the next question.
Yeah, let's see. Seems like it's a complicated way to do things with hospitals, pharmacies, and local private doctors. Would a national healthcare database, if it existed under a universal healthcare, would that help a more efficient rollout for future pandemics?
That's a really good question. It would be nice, and I'm envious maybe of some of the European countries where everybody is on a national health database, and so it's easier for the Englands and the Norways and the Israels to know everybody is in one data set and who has not received it. And we don't have that kind of a national data set, but each person or each entity of health system has its own. We do a lot of work to try and create a statewide registry system or information system. Coreo is information sharing across health plans so that if you show up in an emergency room, they can see some of your information if you're not in that system. And I believe we'll be working to build more out in our vaccination work to have some standardized data sets. The challenge, I think, from the state is that if we build something, then we need to make sure that it can talk to UC Health, and it can talk to Banner, and it can talk to Denver Health, and it can talk to, so that interoperational aspect is yet a bigger hurdle if you're trying to collect information from the vaccinators. We have something in place that's actually quite good, the Colorado Immunization Information System, CIIS. It's a statewide registry of all vaccines, and every provider has to put in the COVID vaccine information 72 hours by 72 hours of giving it. And it does have the capability of sending people reminders to recall them and bring them in when it's time for their second dose. So we'll be using that data set for a lot of our outreach work. It's not maybe as robust as a national system, but it's certainly something.
So since we're working with these healthcare systems, there was a question from Harriet about what kind of guidance is being given to these health systems as far as how to prioritize within those groups and those people that have signed up.
We talk with them quite a bit. Every week we're on the phone with them, and I'm sure most days we're connecting with them and answering questions. I've got questions from them today that I'll be answering after this call. So there's a lot of connectivity and back and forth. And we're trying to be clear too about our prioritization. One of the challenges you'll see from time to time is that we'll send out a bunch of doses, and it might be a smaller county, and they can get through all their people 70 and older and then have some doses left over. Can they move down into the group under 70? Can they start doing essential workers? We're really trying to say no, and we'll pick those doses up because we think it's fair that those doses come back and are given to other 70-year-olds and older rather than being used. And you can imagine from a communications place, and it starts to become an issue when one county is doing things at a lower age and the others don't have enough for the people who are over 70. And it becomes a story in the paper that you have to to manage. And so just to keep things fair and manageable, we say you really can't use those doses for lower age groups or other essential workers. And that's hard because they have the doses and they have people who would benefit from it, but we're asking them not to do that. So lots of communication, and yet we still sometimes hear that this health system was doing it this way. So we have to follow up with them and say, no, we really can't do that yet. So we send them formal letters that, across all health systems that said, this is who we're using it for, and this is who we're not doing it for. And we won't send you doses if you start doing it on these other folks. And so we really, we really have to manage that.
And I think a good follow-up to that then is when you're talking about multiple different places and hospitals and different entities to get these vaccines. So there's a question that said with multiple hospitals, people 70 and older are signing up in 2 to 4 different places, hoping one of them comes in soon. Doesn't this present a false number of people in the queue as they get their shots?
It does. Thank you for that feedback. And I'll take it back to the team and see if there's a way that helps. It certainly sounds like it would create more work. If the person's calling to say, we have doses, oh, you've already been vaccinated. Oh, you've already been vaccinated. Oh, you've been unvaccinated. Then I've spent an hour of my time calling people who were on a different queue and got vaccinated and never took their name off of a different queue. So there's probably an opportunity to think about how can we improve on that. We may be stuck with asking people to say, hey, can you go back in and let people know that you got vaccinated and get your name off of other queues. I don't know that we'll be able to pull queues and compare and remove, but all that is something we should think through.
Yeah, there's one more question here. I logged into Kaiser to get their vaccination into their vaccination queue. Should I feel confident that there's nothing else I need to do and that Kaiser will contact me at the appropriate time?
Yes, I'm taking a guess here. It's like one of these bets, but I do think that if you're on these lists, then you're on the list. And my wife is on the list at KP. She is under the age of 65 and has no health concerns. So she's actually in that phase 3 of healthy folks. And so she's on a list at Kaiser Permanente and probably won't get contacted until May unless there's some more vaccines coming up. But on the other hand, it's good that she's on the list because maybe that will, of all those people who are in phase 3, maybe she's a little higher because she registered today compared to somebody who registers in 2 months. So I don't see the harm of getting your name on the list now.
It's good having your Kaiser background for that question. So I've received a number of emails regarding the next question. And so I know how I've been responding, but I'm very curious if my response lines up with your response. If you are healthy, why is it necessary to be vaccinated? If someone is not comfortable being vaccinated, will there be a mandate to force people to be vaccinated in the future?
Good questions. So you're probably aware that the best way to control a pandemic is to make sure that everybody in the population is immune. And think about the measles virus right now. If somebody travels to Denver from a country like the Ukraine, where they've been having trouble with measles, and actually arrives and has measles and has all these contacts with folks, because we're all immune to measles because of the measles shot, that person can't spread it. But if a lot of us haven't gotten the measles shot, then they might spread it to 1 and that person might spread it to 5 and so on. So one of the best protections for a community against a disease is to have everybody to be immune. Even the young folks, if they're immune, can't then spread it. We've seen certainly in Colorado and other places that some of the highest rates of spread are the 18 to 25-year-olds who, they're out socializing and they don't have always a lot of symptoms with this disease, and so they can spread it. And so they'll be particularly important to be vaccinated as a way of getting immunity throughout the community. So it will be important. we don't really, there's no mandate to be vaccinated. Vaccination is a personal choice. And sometimes an employer, though, might say, I'm going to mandate it. And in the United States, in Colorado, a private business has the right to say, I'm not hiring somebody who smokes. I'm not hiring somebody who doesn't get the flu shot because this is the kind of work we do, and I can't have flu in my business. Or I can't have COVID-19 spread in my business. And so my understanding is that they have the right to do that as a private employer. I don't believe public entities like the state and some other groups can do that. I know historically organizations might require flu shots, or if you don't get a flu shot, you have to sign a declination form and you must wear a mask when you're in the flu season. And if you get a fever, you are out and can't come to work for a week to 2 week period. So there are ways of trying to control it so that those businesses can stay viable, but otherwise there's no mandate.
Yeah, that was what I had been saying as well.
Right.
So I'm glad that we line up there, that
Good.
there might be some employers that may require it of their employees, but that would be a private business that would make that decision, and not necessarily a mandate from the state.
Absolutely.
And it was my understanding that there were a few of the healthcare facilities that were requiring it of their employees unless there was a particular case as to why they could not receive the vaccine. But in which case, that would again be a private employer situation. I did receive a question that came directly to me. It doesn't look like it went to the group, so no one else would be able to see it. Speaking of FQHCs, this individual has seen a lot about availability at places like Salute. Does Stride also have vaccines? And that's particularly relevant because Stride is in our community. So as it relates to, Jeffco, do you have any information about that?
I do. Stride will be a provider, and if I have a question in my mind, it's have they finished all the signing up for it and are giving doses now, or is it that they will have it in the next week or 10 days? I know that they are going to be definitely one of our partners for administering vaccines. I'm just not sure if it's active today or will be in the next 10 days.
Great. So we had another question that was submitted to us in advance, and I think Lindsay's going to take it.
Yep. So that question, which is also in the chat, is we acknowledge the daunting task of efficiently and effectively distributing the COVID vaccine to the residents of Jefferson County. If you had an army of folks available to assist you in any aspect of the vaccine rollout, what would you ask us to help you complete this project?
I can imagine it would depend on where we were in the phases of the work. And so I don't really need an army to do vaccination right now because I have sufficient vaccinators for the supply that's coming in. But maybe that'll be different in April. Maybe we'll be getting 300,000 doses a week, and we'll be looking to have people trained and vaccinating in big sites. So I don't need that immediately. There's certainly, excuse me, there's always the immediate help needed to inform and educate people who don't understand where it is or how to get it, and their local community could use more information. They might be through church groups or community centers. So if I had a big group right now, it seems like it would be like answering the phones for hotlines to answer questions and being in the community to kind of explain what's going on and where to find information and when you'll be available to get vaccinated. Always connected to the story too about don't let up on all the good things you're doing to stay safe now. it's a, it's the big worry, right? That people all of a sudden think, oh, this means I can go out to bars again and I can go to parties in people's houses. And if that happens, we might need to shut things down again if it looks like our hospitals are being overwhelmed. So there's a discipline on our behaviors that still has to be there. So those are the things that come to mind for me.
I also received another question directly that asks, or it's more of a statement, but perhaps you can respond to it. It is not clear that one will receive the vaccine if you're not a current patient. This info has been inconsistent across healthcare systems. What would be your response to that?
Yeah, you might think that if you're a member of that health system, is there a certain advantage you have because you have a relationship with a doctor or nurse there, maybe you have an electronic medical record that's already there. They can put you in an appointment using their current systems. And it feels like that must be easy if you're already in that care delivery organization. If you're not in that care delivery organization, you call them and they might be like, okay, well, I got to create a medical record number for you because I have to create this dummy record so that my system works. And so we've been very clear that there's not to be any advantage for a member or non-member in those systems, and have been, driving that point to the healthcare delivery organizations. And I think they understand it, and they do have some, natural functional barrier that they have to overcome because their systems are naturally built to take care of their members. And when they're taking non-members, it becomes a little clunkier and they have to kind of build this workaround thing. And so your experience might feel a little different or clunky. It doesn't necessarily mean that they have not prioritized you to the same degree as their members, but it may not quite feel the same because they've had to build this workaround to make it work for you. And I would say if there's kind of direct evidence that this group is getting preferential access than another group, members versus non-members, network, non-network, then let your state senator and representatives know, let us know. I mean, we'd like to know about that because we give them direct feedback and say, hey, you can't do that,
One more question here about the hotline. When you get the hotline up with actual people staffing it, will they be able to do that remotely from their house?
I imagine so. I think it's I'm not sure if the question's probably about the hotline workers, but I'm not sure. Yeah, and so we'll be contracting with a large call center company that already has all this capability for us rather than trying to build it anew. We're certainly not experts in managing telephone lines and call centers and potential queues for all that. So we've identified an organization that we're working on a contract now to get them to take care of all these calls for us. And they're people who are answering maybe in the state at home. I don't think they'll be in a call center per se.
So we have about 5 more minutes of time with Dr. France before we transition to some concluding announcements and remarks. And I think we're going to get a quick report from Commissioner Kraft-Tharp. So if you have any additional questions you want to throw in the chat, now would be the time because we have about 5 more minutes of Dr. France's precious time. I don't know if you've been able to monitor the chat, but several people have complimented you on the information that you've been giving us and just your depth of knowledge on a wide variety of topics. So thank you for that. We did have a question that came in. Is it first come, first served when you call to get your on the list for an appointment? So if you called on a Monday, does that mean that you would be ahead of somebody that called on a Tuesday as far as appointments go? Or how does that work? Is it first come, first served once you're on the list?
I think it may be. It's a good question. I know that Yeah, I'll have to look into that a bit more because I've heard, like maybe you have, a little piece here or there, like UC Health is using a lottery for people 70 and older. And I don't really know if Banner is using a lottery or are they doing first come, first serve. And I probably should better understand that. I do think a lottery is a more fair approach when you have a lot of people that want something and you don't have enough of a supply. It does remind me of something else that I'll mention to those of you who are listening, that there is, as an aside, there are some therapies, some treatments for people who have COVID that are these monoclonal neutralizing antibodies. And these are infused as an IV over an hour, and the antibodies attach to the COVID virus and keep it from growing in your body, and it helps kill it off. And you might remember when President Trump was ill with COVID, we were hearing about an antibody cocktail that he had received early in his treatment. Those treatments are available in Colorado, and they're given in infusion centers. And if you were to Google Colorado COVID treatments, it will show you the webpage at the state of Colorado that shows the 21 sites that are providing these infusions. And these infusions are free. The drug is free. There's an administration fee for putting in the IV and watching you over the hour. But those are billable to Medicare, Medicaid, health plans, and some places are also just waiving it. They won't charge the administration fee. And these are for people who today are sick. I'm sick with COVID. Imagine you have a mild to moderate illness and you have a certain health category, which is you're over 65, you're obese, you have diabetes, in those categories, you're at higher risk for severe disease. And so these therapies are available for you. And I was thinking about this because there could be so much demand that we wouldn't have enough supply. And so the state has built a lottery system that would decide whether you get it or not. If there are 10 people who need it and there's only one treatment, we use a lottery. Today in the state of Colorado, there are enough treatments that if you use the lottery system, you're 100% sure that you're going to get it, because we've just set it at 100% because there's plenty of supply and people aren't using it. So I just make a plug for that because we've built this system across the state with various sites, and we don't always think about it, but somebody called me the other day and said, hey, I've got COVID. I was positive with PCR. I'm mildly ill. Isn't there a cocktail or something I can get? And I'm like, oh, yeah, let me tell you about it. Go to this website, learn about it, ask your doctor. Info about how the doctor can sign you up is right there. And if it's under 10 days since your symptoms started and you're in those high-risk categories, it seemed to reduce hospitalizations by 75%. So it seems to be effective and valuable.
Can you repeat that website?
Yeah, so I can't remember the name of it, but what I say is if you Google Colorado COVID treatments, then the state website comes up as the first thing, and you'll see it talks about the treatments for COVID. This is a treatment. It's not the prevention with a vaccine, but a treatment for someone who has COVID.
That's really helpful. Thank you. I didn't know that. So there's another clarification question. Within the group of 70 plus, will they be prioritizing those with medical conditions?
I don't think so. One of the reasons that's hard is to really say whose medical condition is more serious than another. If there's a limited supply and your primary care doctor said, okay, well, I've only got 10 I can give this week, and I know my patients well, I'm going to bring in these 10 patients because I think medically they're at the highest risk, then that might work. But when you're just trying to get everybody over 70, and now you're trying to say, you're at higher risk, then you're higher risk, and you're lower, and I'm going to put this person higher, it's kind of a tricky thing to do. And so we know everybody over 70 is at high risk. So we're not trying to prioritize across medical treatments.
There was another question, just to kind of clarify about the supply. Someone was asking that, they got their first vaccine yesterday and scheduled for the second one on the 5th. Are they going to have enough for those second doses?
Yeah, I think that's a great question. We've been assured by Secretary of Health Azar, as well as the Biden organization, that the manufacturing is secure and that second dose might be coming off the line next week, and they're confident that it will be produced and available on time. So that's the message we're hearing, and we're kind of working from that. We're not holding any doses back in the state. We're taking the federal recommendations as being okay. That could change, of course. And you may be aware that in the United Kingdom, they've decided to delay the second dose to 12 weeks as a way of getting more doses in people's arms. And I actually think that might be a good idea, because I am confident that one dose works really well. And if you delay it from a month from now to 12 weeks from now, if you got your dose today, does it really reduce your efficacy and protection? Theoretically, I don't think it would. And remember, I've been talking about how we've made bets all year. And you sometimes just have to make a bet during a time of crisis. And I think if we made the bet someday that we were going to delay that second dose for a few weeks, that would be a good bet to make, because more people would be vaccinated today, getting at least partial protection over the next 6 weeks. And I think fewer people would die or be hospitalized in the next 6 weeks because of that.
Well, that is all the time that we have. I just want to say thank you so much on behalf of Representative Titone and Representative Daugherty and myself. This was excellent information. I did post in the chat one of the websites that Dr. France mentioned early on, where you can find more information about vaccines in Colorado it's the COVID-19 Colorado.gov website, specifically about Coloradans and how to find the vaccine information. So if there was a question that was not addressed, you might be able to find it there on the website. And then also, if you had a question that wasn't addressed, you can email myself or any of the other co-hosts here, and we could make sure to pass that on and find an answer for you. So thank you so much, Dr. France. With that, we're going to pass on the program to Commissioner Kraft-Tharp, who's going to give us a quick update on perhaps what is happening at the local level with regard to vaccinations and vaccination programs here in the county, and then anything else that she wanted to update us on. So we'll turn it over to you, Tracy.
Thank you. Thank you very much. Can you hear me okay?
Yep, sounds good.
Good. Hate it when people do that, but I hate it even more when you talk for a long time and you realize nobody can hear you.
Nobody tells you either.
Right. So that was very, very helpful, Mr. France. Thank you very much. That was really great. So the county is responsible for distribution in Jefferson County. Jefferson County has signed up 40 providers to be able to distribute the vaccine. Now, so we have the people that are ready to distribute. We just need to get the vaccine. And that's what we're waiting for. We actually have one of the highest populations of older folks in the state. And so we actually have made a request to the COVID team. So Mr. France, I assume you're going to be hearing this request, so I'll lobby to you right now that the distribution to different counties, that should be made according to the population that you have. So we have a very, very high population of folks 70 and over. We've not been able to get to them yet. We are just completing the 1A, all of the healthcare providers, but we have a lot of over 70s that we need to get to. We hear about other counties, and I hear from people all the time that other counties are already vaccinating their over 70s, and so why aren't we? And we're not because of our high population of healthcare providers, and then digging into the over 70s. So, Mr. Friends, when your COVID team gets together, if you all would consider that, this is your lobbying effort. I would really
Thank
appreciate
you.
that.
I'll just say that we are going to move to a process where we look at the population and we just distribute by percent. And so you will get more, I think, because of your population stuff going forward.
So what a great lobbyist I am, aren't I? I ask and he says, okay, that's just amazing. So in Jefferson County, we have a sign up. Go on the county webpage and you can sign up to get information of everything you ever wanted to know about COVID and vaccinations. If you don't want to sign up for that, go on my Facebook page, Tracy for Jeffco, because I'm posting most of that information on there. There's 2 resources if you want to follow up on what Mr. France was saying today. One is the Arvada Chamber did a presentation yesterday, both with state and county, on vaccinations. The recording of that is on my Facebook page, Tracy for Jeffco. Then next Saturday is a town meeting in Jefferson County that with commissioners Andy Kerr and Leslie Dahlkemper, legislators Tammy Story and Lisa Cutter on vaccinations and all COVID. And that's next Saturday at 9 o'clock. That information is on Tracy for Jeffco Facebook. So if you want to follow up with that, if you want more information. That's kind of the information I have to share with people. But Mr. Friends, I have a question. So Jeffco has signed up with 40 providers to help with distribution, and Safeway and someone else is starting next week to distribute. Do those providers get paid?
They can get paid. They'll get paid through any billing that they do for the administration of the vaccine, and so there's no cost, of course, for the vaccine itself, but they will get funds. I think too, we're going to be working through that to a degree because we just learned we're going to get like over $50 million from the new stimulus money that was approved, I think, in December from the federal government that will just focus on vaccination. And so many of the care delivery systems are saying, you know, I lose money every shot I get. Can we figure this out so that this is manageable? And so we'll be working through that now.
Okay, that's helpful. I was just wondering what their motivation is for getting more people to come in and do shots within their system. So other than that, that's all I have to say. Thank you very much for allowing me to give the county update.
Great. So we will wrap up with just a few announcements and we'll kick things off with Representative Taton.
All right, thank you very much. This week, this weekend, this is kind of short notice, but I'm doing a food drive for the community table. President-elect Biden, he is doing a National Day of Service on Monday, the 18th. And I've decided to try to do a food drive at the last minute to try to raise some money for the folks who are in the most need. So we've got some little flyers here that are going to go up and how to donate and help. We're going to post this on social media. But if you'd like to participate, if you have a good neighborhood where you can put your box outside your door and contact your neighbors, you can do that. We're going to have these around some of the businesses in Colorado, in Arvada here. And, we're also looking for anybody who might want to help pick up boxes and deliver them to the community table to make sure that they can get their food. If we get a lot of people participating and working on this, we may go past Monday, as long as people are giving some food and everything. Also taking donations for the community table. If you can't find any food or you can't do it at the last minute, you don't want to leave your house, you can still help out and give some money, because right now there are a lot more hungry people than normal, and they need our help, and you can help do that. Harriet, do you want to say any additional things about that? Harriet's on the board of the community table.
I wasn't prepared for that, and I really,
Couldn't
there's
reach
really
the
not a
mute
lot
button.
more to add other than from something that Sandy Martin, the CEO of Community Table, told me, it sounds like the number of people who are in need of food, who are food insecure, has like tripled in the last year. So it really is an important need, and I think it's just fantastic that Brianna decided to take this on. Representative Titone decided to take this on as her day of service, and I was certainly thankful that I could help hook her up and get this thing going. So please donate. Thanks.
Yeah, thank you.
Thanks, Harriet.
And you know, this is, you know, a National Day of Service. So, you know, whatever you can do, feel like you're making a difference and participating. You know, we all chip in. We can make the community better, and donating some non-perishable food, hygiene products, things like that, stuff for kiddos. We can really help a lot of people get through the next few months, which are going to be the most critical ones right now. So that's my big announcement right now. So please contact me if you want to take a more participatory role, and I'm happy to get you on board. Thanks.
And then I'll just jump in really fast. I think today was very informative, so I'm happy you were all here and we were able to facilitate that. If anyone has any questions directly, I'm more than happy to help you with the process or procedure or try to get you an answer. So feel free to contact me directly, and I'll just be posting updates and getting my website all up to date and everything so that you have the most information you can have. So thanks everyone. It was great to see you this morning.
And again, I just want to thank Dr. France for his presentation today, and remind folks that if you have additional questions, you can forward them on to us, and then we will try to track down the answers for you, as well as the link that we put in the chat. The legislature we convened on Wednesday, and we did just those quick short bills, and then we are now in recess. We are in recess until February 16th, unless something comes up that would require us to come back sooner than that. So we left things open in such a way that would permit us to, if necessary, be called back to be able to come back and start back up. The way that the legislature works in Colorado is we only have 120 days. And last year when the pandemic struck, we didn't know whether if we took a break, whether that time in which we were in recess would count against our 120 days or not. And so we asked the Supreme Court for an opinion from them to kind of weigh in as to the interpretation of our Constitution. They indicated to us that we would be permitted in a declared health emergency such as a pandemic to go ahead and cease our operations temporarily and then pick up where we left off. So we have had 3 legislative days within our 120-day calendar. And so when we return, presumably on February 16th, it will be legislative day number 4. It is all the days, though, not working days. So we do count weekends towards that. And there have been occasions where we have had to work on a Saturday or a Sunday. So we during the meantime, in this little recess, legislators will be receiving the vaccine so that when we come back in February, we can have an additional layer of protection as well as our staff. I did see a question in the chat regarding safety precautions down at the Capitol. As you've all heard, there have been some increased news and announcements about potential violence down at the Capitol next week. And the Capitol complex is under the authority of the Colorado State Patrol. So they will be taking measures to make sure that the building itself is secure, and that any staff members that may be working down there on that day are well protected. But the legislature will not be in session next week because we have temporarily recessed until February 16th. Besides the Capitol and the Capitol grounds, grounds, everything beyond that, including the park that is directly across the street from the Capitol, is actually within the city and county of Denver. And so any rules or laws or enforcement would actually fall to the local Denver Police Department with regard to safety protocols down at the Capitol. So I would direct any additional information or questions that you have about that to Mayor Hancock and his team and the Denver Police Department. I will give a quick shout out, however, to the Colorado State Patrol. It was a little nerve-wracking in those 3 days that we were down at the Capitol conducting our business, given the incidents that had happened just the prior week. And I would say that my safety, I felt safe the entire time that I was there, and the Colorado State Patrol and our Sergeant at Arms seemed to be well equipped and prepared for any possible incident, while still maintaining full access to the public, to the legislature, so that you could follow along. So with that, it is noon, so we're going to wrap up our town hall. I just want to say thank you so much. We will be moving forward with our town halls virtually for the foreseeable future. So I do hope that you will join us 1 month from now on the 3rd Saturday in February, which will be February 20th. And all of that information will be posted on my website, rachelforcolorado.com, as well as the websites of Representative Titone and Representative Doherty, if you have any questions about how to get in touch with us and or how to participate in our next town hall. So thank you very much, everybody, for participating.
Thanks, everybody. Bye-bye.
Thank you. Bye.